We're approaching one of the busiest travel seasons of the year, but there's an outcry over new airport security measures that include full-body scanners and invasive police-style pat-downs. Pilots and frequent flyers worry that about the radiation the scanners emit. The ACLU has denounced the scans, and the group Electronic Privacy Information Center, or EPIC, has filed a lawsuit to suspend the deployment of body scanners at U.S. airports pending an independent review. The group alleges that the scanning procedures are, quote, unlawful, invasive, and ineffective. A national protest is being put together over the Internet, calling on people who are flying on the day before Thanksgiving to opt out of the scans and insist on public pat-downs. The stated goal of the National Opt-Out Day is to draw lawmakers' attention to the new security measures and respect the privacy of the flying public. Here in New York City, City Council members introduced a resolution to ban the use of scanners in the city. This is City Councilman David Greenfield.
It's an outrage, it's unacceptable, it's ineffectual, and that's why I've introduced legislation with the support of many of my colleagues in the City Council to ban these naked body scanners from the entire New York City, including New York's airports.
Some lawmakers, like Florida Republican Congressmember John Mika, are pushing for airports to switch to private security guards instead of agents for the Transportation Security Administration, or TSA. On Wednesday, Republican Congressman Ron Paul of Texas introduced the American Traveler Dignity Act, a bill that would hold airport security agents legally accountable for airline screening procedures.
What we're accepting and putting up with at this airport is so symbolic of us just not standing up and saying enough is enough. Let's make sure that every member of Congress goes through this, get the x-ray, take a look, and make them look at the pictures, and then go through one of those groping pat-downs. And then I think there'd be a difference. Have everybody in the executive branch, anybody a cabinet member, make them go through it and look at it. Maybe they would pay more attention. But this, it doesn't work. This is not what makes us safer.
For more on the body scanners and the new airport security procedures, we're joined by two guests from Washington, D.C. Ginger McCall is Assistant Director of the Open Government Program at EPIC, the Electronic Privacy Information Center, and Chris Calabrese is Legislative Counsel with the ACLU. We welcome you both to Democracy Now! I was in Washington at the National Airport, Reagan Airport, and I refused to go through the scanner. And this was a couple weeks ago. I saw everyone going through it. And I said to the TSA guys, I don't get it. Am I the only one? They said, you are the only one who has refused to go through. I think that's hardly the case. But Ginger McCall, can you talk about the scanners, the electronic scanners, and what EPIC is doing about this, and the invasive pat-downs if you refuse, because, boy, you sure get one if you refuse to go through the electronic machine.
So EPIC has been working on this issue since about 2005, and we've actually filed a lawsuit over it to suspend the program while it's evaluated for privacy, health, and effectiveness. We've really been working on this because these machines are clearly a violation of the Fourth Amendment. They're highly, highly invasive, and it's a procedure that is applied to all American travelers.
What's the science behind it? I always wondered, when your luggage goes through underneath, what kind of scanning does that get? Yet when we go through, what is in those body scanners? What is the scanners? What is the level of radiation? Not to mention the pictures they're taking of your body.
So there are two different kinds of scanners. There's millimeter wave and there's backscatter. And the scanners produce a small amount of radiation. It hasn't really been properly tested. There's not a clear maintenance schedule for who's going to ensure that the scanners continue to only put out the proper amount of radiation. There's not proper testing on the effects of that radiation on children, on pregnant women, on immunocompromised individuals. What happens with the scanners is that, you walk through it, you pose, the scanner scans you, and that picture gets sent back to a TSA official in a back room. And it's a very, very invasive picture. It shows, it shows cellulite. It shows love handles. It's very detailed and very graphic.
And also, these scanners are able to store these images as well as to transmit them to other government agencies if necessary?
So Epic had a Freedom of Information Act request with DHS to get more details on these scanners. And we initially made that request. DHS ignored that request, and we ended up taking them to court over it. And as part of that lawsuit, we got documents, a procurement specifications document that was scripted by TSA, and this document described everything that TSA required the manufacturers to put in these machines. And one of the requirements was that these machines be able to store and transmit the images.